Hi, Mr. Bush. My name's Taylor, and I'm going to be your nurse for today. Today we're going to conduct a head-to-toe assessment, and I'm going to start by washing my hands. I'm going to start by asking you a few questions. Can you state your name for me?
Jacob Bush.
Can you tell me where we are?
Hospital.
And can you tell me the date?
April 30th.
Okay. Patient is alert and oriented, times 3. Can you rate your pain for me on a scale of 0 to 10? 0 being no pain, 10 being the most pain.
0.
Okay, patient is experiencing no pain. So first I'm going to start by analyzing your scalp. Okay, scalp presents with no lesions, erythema, or edema. I'm going to assess the symmetry of your face. Face is symmetrical and equal bilaterally. I'm now going to assess the skin quality of your face. Skin is warm, dry, and pink. And I'm going to ask you a few questions to conduct a few tests. Can you smile for me? Can you frown? Puff out your cheeks. Okay. Cranial nerve number 7, the facial nerve is intact. Okay. I'm now going to assess your eyes. Okay, so I'm going to observe for any eyelid drooping. Patient has no eyelid drooping. I'm now going to assess the sclera. Okay, sclera are white and present to be normal. I'm now going to assess the conjunctiva. I'm going to pull up on your eyelid. Okay, conjunctiva is pink with no drainage. I'm now going to assess the symmetry of your eyebrows and eyelashes. Eyebrows and eyelashes are symmetrical and equal bilaterally with no hair loss. So I will now assess your pupils. Look right here at my finger. Okay, and now look at my left ear right here. Okay, pupils are round, equal, and reactive to light. So I'm now going to assess your corneal reflex. Look right here at my ear. Okay, corneal reflex is normal. So I will now assess your ears. I'm going to start with the symmetry. Ears are symmetrical bilaterally. I will now assess for any drainage, foreign objects, or lesions, edema, and erythema. Ears present with no drainage, foreign objects, lesions, edema, or erythema. And now I'll assess your nose. Nose is symmetrical on the face and presents with no drainage. So I'm now going to assess your mouth and your throat. If you could open up your mouth for me. Okay. Teeth present with proper dentition and no decay. Lips are moist and pink. Open your mouth for me. Okay. Gums present to be pink and moist with no abnormalities. So can you stick out your tongue for me? Okay. Tongue presents to be midline with no thrush. Alright, I'm now going to ask you to stick out your tongue and say ah. Okay. Cranial nerve number 9, the glossopharyngeal, and cranial nerve number 10, the vagus nerve are intact. The uvula is midline and does rise. Stick out your tongue for me one more time. Okay. Cranial nerve number 12, the hypoglossal nerve, is intact. The tongue is medial and does not shift. Okay, open your mouth one more time for me. Okay, assessing the hard and soft palate, which are moist and pink. And tonsils are a grade 2 with no lesions, edema, or erythema. So I'm now going to assess your neck, starting with the skin. Skin is warm and dry and equal bilaterally with no lesions, erythema, or edema. I'm now going to palpate your carotid pulses one at a time. Okay, pulses are present, equal bilaterally, and bounding with a 2+ strength. So I'm now going to assess your chest. I'm going to go ahead and lift up your shirt. Sit up for me. Okay. I'm going to start with the skin. Skin is warm and dry and equal bilaterally. I will now inspect your respirations. Okay, respirations are present and not labored at a rate of 18 per minute. Skin temperature is warm and dry. I will now assess your skin turgor right at your clavicle. Okay, skin turgor is normal and within 1 to 3 seconds. I will now listen to your breath sounds. Okay, take a deep breath. Another one. Another one. And again. And again. Okay. Breath sounds are equal bilaterally and normal and present with no crackles or abnormalities. So I will now assess your heart, starting with the apical pulse, starting mid-clavicular and going down to the 5th intercostal space. Okay, apical pulse is bounding with normal with a rate of 72. I would palpate that for 60 seconds. So I'm now going to assess your heart sounds, starting with the diaphragm of my stethoscope, starting with the aortic, pulmonic, tricuspid, and mitral. Okay, I will now auscultate with the bell of my stethoscope, aortic, pulmonic, tricuspid, and mitral. Okay, all heart sounds are normal with no murmurs or abnormalities or arrhythmia. So I'm now going to ask you to lay down on the table. I'm going to assess your abdomen. Okay. First, I'm going to start by raising up your shirt. I'm going to assess the symmetry. Okay. Abdomen is symmetrical with no distension, erythema, edema, or lesions. I'm now going to assess the skin color and the temperature. Okay. Abdomen is warm and dry and pink. I will now assess your bowel sounds. Starting in your right lower quadrant. Right upper quadrant. Left upper quadrant. And left lower quadrant. Okay. Bowel sounds are present and active. Okay, I am now going to palpate your abdomen, starting with light palpations to deep palpations. Please let me know if you feel anything uncomfortable or any tenderness. Starting in the right lower quadrant, light to deep, light to deep, light to deep, light to deep. Did you experience any pain or tenderness?
No.
Okay, go ahead and sit up for me. Okay, I'm now going to assess your upper extremities, starting with the symmetry. Upper extremities are symmetrical. I will now assess the skin color and the temperature. Okay, upper extremities are warm and dry and pink. So I'm now going to test your strength and your grip. Grab my 2 fingers and squeeze as hard as you can at the same time. Okay, grip is present. Hold your hands out like this. I'm going to press down on yours. Try to press up against mine. Okay, strength and grip are equal bilaterally and strong. I'm now going to assess your radial pulses. Okay, radial pulses are present, equal bilaterally. and bounding. I will now assess your capillary refill. Okay, capillary refill is normal and within 1 to 3 seconds. I will now assess your lower extremities. Okay, I will start with the symmetry. Lower extremities are symmetrical and equal bilaterally. We'll now assess your skin color and temperature. Okay, skin color and temperature is pink, warm, and dry. I'm now going to ask you to lay back. Okay, take one leg and bring it to my hand. Straight out. Okay, and press up against my hand. Perfect. Okay. Strength is normal. You may sit up. Okay, I'm now going to assess for pretibial edema. Okay, pretibial edema is negative. And I will now assess the posterior tibial pulses. Posterior tibial pulses are equal bilaterally and present. I can now get you to remove your shoes and your socks. Okay, I will now assess the dorsalis pedal pulse. Okay, dorsalis pedal pulse is present, normal, and bounding, and I will now assess your capillary refill. Capillary refill is normal and within 1 to 3 seconds. That'll be all for today. Thank you for coming in.